Make your business case interesting. I don't mean put it on scented violet paper. I don't mean use snazzy words, but just make sure that the people who are reading it are drawn into the document. In other words, give it some soul, give it some humanity. It may well be an incredibly complex, detailed document, and you do not want to use the emotional wild card as a way of trying to blackmail people into saying yes. But remember, these people are probably reading 5, 10, 15, 20 business cases per week. So it's a bit like a CV or an application form for a job. Just make sure that there is enough in there to draw the reader in. Second piece of good practice, get it right first time. Don't send it off to an organisation only for it to come back full of red pen marks saying, not sure about this, you haven't explained that. Because even if you do it a second time and send it back to them, they can't unremember that this was the business case that was so flawed last time. So it's a good idea to read it through, get it right, and this is a really important point, check it with somebody who doesn't work in your area. They may not know the technicalities, but they'll be able to tell you whether or not it has the right tone, whether all its arguments come together, or whether there are some loose ends. Don't leave yourself in the position where you think it's brilliant, but it goes to somebody outside your profession who looks at it and goes, I have no idea what these people are talking about. Demonstrate value. Make sure that your business case is more than just a stopping the rot business case. It's something that will take the service forward. Politicians, administrators, managers, the whole mantra these days is about service improvement. So don't be defensive in your business case. Try and make it a case that's actually a step change, moving things forward rather than just preventing them from getting worse. I know that sounds a little optimistic. You may feel that the business case that you're putting in will just stop the rot, in which case be honest about it. But wherever possible, try and make sure that the business case moves the service forward. And the final thing to say is make sure that the audience you're sending it to will be able to understand what you're saying. For example, and I don't want anybody to misinterpret what I'm about to say. I'm not talking about intelligence levels. I'm just talking about familiarity with the language and the concepts. As clinicians, you know that some of the information that you put out to patients would be different in style and tone than information you would put out to your fellow professionals. So if you're sending a business case beyond the medical profession, you may well have to use concepts and phrases which are not your everyday ones, but would resonate and make sense in that organisation that's looking at it. Similarly, if you are having to go to a charity or a self-help group with a business case, they may need a completely different tone and style of document. So don't just prepare a medically perfect document which you talk amongst yourselves and say, this is absolutely brilliant, and then just send it to an organisation that doesn't speak your language. The risk is that you will be accused of patronising them. The second risk is they'll say no because they'll miss the nuance. They'll miss the things that are really important because of almost their word blindness to some of the concepts that you're introducing. So, just to summarise, business cases are here to stay. It's no good as clinicians saying, oh, this is just endless bureaucracy. Why do we have to fill in these forms and these templates? If you want the public sector to say yes, they'll want a business case, particularly where there is money at stake.